looking in the book and with an educated guesses if we were having a question like this. I want to decondition you to this fact that the truth is what Hesse says, that the truth is what Kaplan says, that the truth is what, okay, you world say, or the truth is what Vallin says. No, I want to decondition you. I want you to start thinking by yourself. And this is something that is going to be explored by the Nclex, because the people that write the Nclex are much infinitively much knowledgeable and smart than Hesse, Kaplan, and Vallin. You understand? So for that reason, you need to start, practicing. What would you do in a question, okay, if you were having this question in a test, okay, without depending of checking what says Vallin or what says Kaplan or what says Hesse, what says, because at that moment, in the moment of the Nclex, any of us is going to be of help. Only your knowledge, your common sense, and the test. The nurse is teaching a client with COPD about safety with the use of oxygen. Which of the following are correct statements? Probably this is easier. I will post a sign prohibiting smoking in my house. Of course, no. Everybody agree, no? Yes.
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 I will avoid using the microwave while receiving oxygen. What about this?
No.
No,
No.
there is no sparks associated with microwave.
No.
There is no combustible associated with microwave. So I don't think it should be answered as possible. I will use only cotton cloth when using oxygen. What do you think about this? Yes or not?
Could be.
Why?
Yeah.
What is the rationale of using cotton and not synthetic, no wool or other kind of fabric? Guys, have you ever?
Synthetic are more flammable.
No, both cotton and the others are. I think that
Electrostatic.
as this is
Electricity.
the static electricity. This is the answer. Okay, this is the answer that the book gives. Synthetics, nylon, etc., and wool easily produce static, accumulate static electricity. And the static electricity produces sparks, no? And the sparks, in presence of oxygen, if there is a combustible like a linen, etc., can, light the linen, and they can be a fire. So that's the rationale for recommending the linen and the stuff, because cotton don't build static. Have you ever been sitting in a sofa or even in the car, especially when there is cold, the day is dry and cold, and then you touch something and you feel like a spark? Never happened to you? It happened to me all the time. I have a sofa that charges me each time I sit in the sofa. So it is correct. I will increase the oxygen flow to more than 2 liters only if I am too tired. Yes or not? Is this safe or is not
No.
safe for the COPD?
It's not safe.
Is not safe.
No.
Is not safe. Okay, so it is not safe. If they are alone at home, they should not increase by themselves the flow of oxygen, because remember, they could develop respiratory depression because the hypoxemic drive is taken when the oxygen is high flow. I will check if the cables, the electricals are frayed, of course, because if they are frayed, are going to produce a spark. It's an easy one. Which of the following nursing interventions are correct in the management of a victim of rape? A very stressful situation. I hate that. Reassure that she did. Okay, it is a stereotype applied also. Reassure that she did the correct to save her life which is the most important. Is this correct or not?
No.
No.
No? So she should fight until death to preserve her honor and the integrity of her, I don't know, virginity.
Mm.
I don't know. This is the way that you need to think. Remember, you are in the test. You have this question, and you have intelligence, and you have time to think. So if somebody is the victim of a rape, is supportive or is non-therapeutic? Telling the person, you did the correct. The important is to save the life, okay? So obviously, you have two options when somebody's raping you. You can fight till death, or to be very, very traumatized or very harmed. I think that you can imagine that you have the intelligence to try to understand that somebody very strong is raping you, and you can fight and you can fight, and they beat you, and you can fight and they stab you, and you can fight and they strangle you, but you preserve your honor. Or you give up and you are raped. Of course, this statement, hey, I know that this was humiliating, but you saved your life, which is the most important. Do you think it is wrong? I don't want to.
No.
I don't want to influence you, but I think that there is a need of a little common sense. No,
No, for common sense it's okay, but it's very hard.
it's very hard, but it's the truth.
Yes, yes, yes.
Because I'm explaining again. I don't want to explain that
That's
again. It's
right.
your life versus being
Yes,
raped.
yes, of course, you. That's right.
That's it. So this is the way that in the test, you are not going to have me in the test. You are not going to have anybody in the test. You need to talk to yourself. Okay, let me imagine that I am the victim of this rape, and I gave up. Okay, because I was very afraid of this knife that the rapist was showing me. So I gave up. I allowed the rape. Okay, could be uh could be reassurant, could be supportive that somebody tell me, you know what, rape is going to pass, but you are alive. I think that you did it correct. Don't you think that this kind of support is not going to help me? So I try to put myself in these situations, and then my mind clears up. And this is not knowledge. I'm not talking here about knowledge. It's not because I have more knowledge than you. I'm just talking about common sense. And this is something that all we have, and we have the same level. The only thing that we need to calm down, forget Hesse, forget Beijing, forget Kaplan, forget, and then Nclex is a good, almost perfect test that confront you to real life scenarios where people expect that you answer with common sense. And as I said before, the first time that I read that brought a lot of confusion to you. You were very suspicious. And you say, no, it's no good. But trying to think the meaning of this statement, trying to apply, because I think that has no discussion that it is good. It's an adequate reassurance. Okay. If she wants to take a warm shower to be clean and eliminate all this humiliation and this dirt and this stuff, okay, it's okay?
No.
No.
Very
No.
important that you convince them need to wait until all the specimens that need to be taken in rape cases are taken before showering. Very important detail. I remember another question, Nclex, that which one was the most important question to ask to a rape victim that was arriving, consulting in the ER? And the answer was, did you take a shower? I don't know if you watch movies. Do you? I know that you are all time studying. You never go to the movie. You never watch TV. I know that you are incredible. But I watch movies. I watch movies where people have been raped, men and females, and the first that they did were take a shower because they felt dirty. You understand? But then you eliminate all the evidences. Okay, all the evidence. So now everybody understands, and it's easy to understand why this auction is a no-no. Make her sign the consent to administer antibiotics and post-exposure antiviral. Do you think it's correct?
No.
Why not?
Yes.
Why not? Tell me why not? Why not? Why is not good to give the consent form where he authorizes the use of antibiotics to treat chlamydia and gonorrhea and syphilis, and antivirals to treat HIV, hepatitis B and C, as a post-exposure prophylaxis. So, do you understand what it means? No, I am victim of a rape. The rapist escape is not taken yet. We don't know which kind of diseases has this rapist. We have bacterial diseases like gonorrhea, chlamydia, syphilis that are transmitted sexually, and this was a rape. And antibiotics could be used prophylactically. And when we have a needle stick or we have any exposition to body fluid, and the patient has confirmed HIV, or we don't know the status of the person, it is indicated the post-exposure prophylaxis of HIV. And we need to know this. Well, my students should know that because I taught that when I taught HIV. I explained what is post-exposure prophylaxis because I wanted my nurses to be sure that if they have an accident, a needle stick or something like this, I wanted my nurses to know that exists the post-exposure prophylaxis that can prevent catching an HIV. If you don't believe me, go to the PowerPoint of my class in Nurse Concept 2. If you remember that you took Nurse Concept 2, but it is true. It is true. It is true. Okay, and that's it. And I think that is correct. Okay, I think it's correct. Always for the administration of any medication, there is a consent. No, for any intervention, it's a consent always. Even to be hospitalized or to be admitted, you need to start signing a lot of paper. No? So I think that is correct. Facilitate phone calls to make family and friends aware that she's in the ER. What do you think about this? Critical thinking?
No.
No?
No.
What's the critical thinking of not allowing her or him to contact family and friends, okay? Because it's facilitate phone calls to whom? To the client, to make them know. Okay, so suppose that you have a girl, 18 years old. She is starting college, something horrible. She went to college, to class. She was raped. She went to the ER. Is adequate to allow her to call her family? Tell me, yes or not?
Yes.
Okay, so I insist, maybe as usual, you think that I'm very annoying, very nagging, very fastidioso, but I insist again. You need to activate your common sense, your critical thinking, que si lo tienen, that you have it, okay, in the moment of the test. What I'm doing, why I am speaking, because I've been raped, because I'm a rapist, because I study a lot of rape. No, I hate this topic. I cannot imagine how a person can rape another person. This is beyond my stomach, okay? But my common sense trying to visualize a possible scenario that can be perfect visualized by you. So when you have this kind of question, first trying to understand what is written in the statement in plain English, because it's very clear, facilitate phone calls to make family and friends aware that she is in the ER, because we are dealing with a female victim of a rape. Yes, of course. I don't see what's wrong. That you are going. What the problem? Probably you misunderstood, without reason, that you were calling the newspaper, the TV, etc., to tell that Mary Smith was raped tonight. No, it is not. It is facilitate phone calls to make family and friends aware that she's in the ER. Who is making the phone call? The client. Who is, requesting the phone call for the family and friends? The client. The client. You understand? Okay, so that's the purpose. Let me erase. I save all this garabato. Just a moment, guys. Have patience with me. Okay? And that's it. This is the way that I want you to think, because here I'm not reviewing content. I'm reviewing, strategies, way of thinking, a way of thinking at the moment of the test. And the last, ask if she knows the rapist from her neighborhood or work.
Yes.
Yes.
Is this the role of the nurse?
Yes.
No.
The role of the nurse?
Oh, no.
I have
No.
doubts. I have doubts
No.
in this. I have doubts in this option. The other option didn't give me any doubt, but I have doubts in this option. So remember, this sensation of doubt, of insecurity, is normal. Normal. Normal to be in your Nclex. And it doesn't mean that you are going to fail, because it is real. Okay. Again, which importance or which benefit from the point of view of nursing has the fact that if she knows the rapist from the neighborhood or work or the family, etc., I think that it is something that needs to be asked by the police, not by
Yes, yes.
the nurse.
You're right.
So, as I repeat, I'm not being in this scenario, but I have the common sense of placing myself in this scenario. Okay, and nada, I just need to place myself or a family member or somebody that anybody in this scenario. I think that my level of empathy will bring me the correct answers. And this is what you need to do in your Nclex, guy. Okay, you need to use your brain. This good brain that I've been always telling you that is very good, like the one that you use when you want to argue with me. The students were my students that I told you you should be studying in law school, not here in nursing. No, okay. Use that brain to pass your Nclex. Because as you notice, it is not knowledge, it is common sense. Well, a little knowledge, but the majority is not knowledge, it's common sense. In which of the following 4 cases the nurse anticipates that a multidisciplinary team must best manage the client? Atrial fibrillation, sickle cell disease, cystic fibrosis, Hodgkin lymphoma. Which of these 4 diseases require the most a multidisciplinary team?
Cystic fibrosis.
I agree with you. I agree with you. Because this needs the hematologist, pardon, the cardiologist, okay? The cardiologist, yes? Needs the cardiologist. This needs the hematologist. This needs the oncologist, yeah? But cystic fibrosis has affected all the body. So first you need the geneticist because it's a genetic disease. The geneticist to determine the risk of the future for these parents, okay, problems. You are going to need the lungs are very affected, the pulmonologist and the respiratory therapist, no? Respiratory therapist. No? You have a lot of problem of digestion, absorption, exocrine pancreatic insufficiency, and malnutrition. So you need the help of the dietitian and the GI, expert. And it is a very complex patient and very, very chronic, no? Very chronic. Okay. So obviously it's the most complicated, the one that is going to require more of a multidisciplinary team dealing with the disease for long, long, long term. Okay. Good, good. A client is in stage 1 of labor in the latent phase and complains of intense back pain. In which position the nurse placed the client for relief?
Left lateral.
Of course, this is a position that is going to relieve the tension of the back and also is going to favor the blood flow in the uterus. So you are going to favor the left lateral, okay? The left lateral. Remember that the supine with lower extremities flex is the Williams is okay in non-pregnant, okay? In non-pregnant women, that is going to be, okay, a patient in this position, okay? In this position. The macro-overs is a position that is going to be placed, the pregnant woman, if there is something called shoulder dystocia, that is hyperflexion of the hips and the knees. So one nurse need to hold this leg, the other nurse the other leg, and push in this direction to facilitate the exit of the shoulders. The head is already outside, the head of the baby is already outside, but the shoulders are not leaving. And then this is the macrovers, hyperflexion of the hips. And left lateral is better than right lateral because the right lateral can compress the inferior vena cava. So I would answer also left lateral. I would be choosing left lateral. Good, good. Good. Okay, last time we talked about this cafe only, okay, spots, no? So we already, so remember the following, guys. If somebody told you about a question that this person had in English, anticipate that you will not have exactly the same question. You are going to have about the same topic, the same content. You're going to have another question. They change the question. I always say to make people, to see people understand me, because sometimes I feel that people don't understand me because I don't express myself correctly. But of each question that you see in English, that you find that somebody tells you in English, they have 99 different versions of this question. Okay, so now you remember that we had there a question where you needed to understand that neurofibromatosis had cafe au lait spots, but now the question is they give you a picture. There are many pictures, okay, in English, many questions with pictures, and you need to visually identify what is it. So obviously we went, we Google the cafe au lait, okay, spots, and we already saw it. client receiving torsemide IV and is presenting a common side effect of the drug, which EKG correlates with this scenario. Oh Lord, they're so big, cannot be shown at once. Just a moment. Okay, just a moment. Let me see, I can fix it. Too big. Then I'm not solving anything. I need to move. I need to move down. Ah, ya la borré el. Well, now you can see that, okay? So trying to imagine, let me see, it's better this way. Okay, much better this way. Okay, so now I can magnify. Much better this way. Okay, now you can see that better. Okay, and okay, so which of these 4 EKGs do you think is related with torsemide toxicity?
A.
No, it's C, because they have a U wave that is hypokalemic.
Very well. The torsemide is the same as furosemide and bumetanide. It's a diuretic, it's a loop diuretic. Yes, so furosemide, bumetanide, torsemide are the main loop diuretics that you need to know. Loop diuretics are very potent and are potassium wasting, throw away potassium, yes? So the expected alteration is hypokalemia, and the hypokalemia is manifested by the presence of the U wave. So normally the EKG has a P wave, has a QRS and ST and T. PQRST. Which letter comes after the TU? So if you see that the appears an extra wave, yes, an extra wave, yeah, after the T, usually it is in reality the most common situation is to see that the ST segment is a little depressed, the T wave is negative, and then appears the U wave, okay? So this is the most common. But the important is that appears an extra wave that normally is not present after the T wave, positive or negative T wave. And this is what you see here, okay? Here you see the P, sorry. Let me aim a little more. You see the P as in potato, yes? You see the QRS here, yes? Then you see the T as in tears, and the U as in useful, okay, here, okay? So this is the U, the T, the QRS, and the P, yes? So you are seeing TU, 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 yeah? Okay, so you can see that here. And yes, this is the way of answering this question. Is clear the concept of two-way? Okay, and if you see this first EKG, if you see this first EKG, which detail calls your attention?
The T wave is very high.
T wave is very high. Is very high. Yes, the T wave is very high. You see here. So the P is flattened. It's very flat. It's not visible. The QRS is a little wide, but important because those are also manifestation of hyperkalemia. But the T wave are tall and peak like the Eiffel Tower, yes, like a TP, no? Okay, so this is the characteristic of the hyperkalemia. What we have here is a irregularly irregular, okay, RR interval, and in absence of P wave, but in presence of a narrow QRS. This is an atrial fibrillation. This is an AFib. This is an AFib. And here, what calls my attention is the presence of a perfectly straight line, yes, that tells me that it is not God business, it is artificial stuff. So obviously, this is the spike of a pacemaker. So it is a properly working pacemaker. Yeah, it's a pacemaker. No question, yeah? Okay. A 30-year-old female client was otra vez. A 30-year-old female client was sexually abused by a gang rape. It's one of the worst scenarios in rape when there are several individuals abusing of the victim. 11 hours later, the client is brought to the ER. Late, no, 11 hours. The nurse observes that the client remains sitting on silence and acting like nothing happened. So the nurse something calls the attention of the nurse. Not is that. So what a nurse or a common sense person expects of a person that has been humiliated, abused, traumatized by a group of abusers to be affected, to be crying, or to be very upset, or to be very fear, very afraid, etc. No? Okay. So now the person is all the contrary, is sitting on silence and acting when the nurse observes interaction like if nothing had happened. Which defense mechanism is this client using? Denial, projection, repression, or regression?
Repression?
Sí.
Yes.
Voluntary forgetfulness.
Yes. This is the mechanism of defense that is used. Repression. Absolutely. It's repression of the memories. It's repression of the experience. Yeah. Repression. I agree. This is repression. This is repression. Okay. Regression, what children do when they are sick or the parents are divorced or if a new sibling arrives. Projection is when you blame others of your faults. Denial is when you express negation. You negate. You say no, it didn't happen. Okay, 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 didn't happen. Okay, and then this is denial. It's not happening. The charge nurse is evaluating the new nurse perform a physical exam of the thyroid gland in a patient with hyperthyroidism. Which action is the new nurse doing correctly? So the question is how you assess thyroid. Cellular apply. So tells the patient or the client swallow a small sip of water while observing the thyroid moving. Is okay or not?
Yes.
Yes.
The correct way of doing inspection of the thyroid. Move a mobile lamp closer to observe the neck with bright light. Yes or not?
Yes.
Yes.
So if you were in your exam, you were having like me doubt, but then you say which harm could produce have a good illumination at the moment of inspecting the thyroid. There is not need, there is no technique of shadows to evaluate the thyroid. So to evaluate the lumps and goiters that you can see in the base of the neck, the same as scars of previous surgeries, etc., I think the light is going to help. So I don't see any harm in having a good illumination to assess, visually assess, to be redundant, the thyroid. So at the end, after thinking a little, I say yes. In my case, remember that if I were taking the test, I answered that the same way that you did. Stands behind the client while doing palpation and asking the client to swallow. Is this correct?
Yes.
No.
No,
No.
no, because this is behind.
Behind.
For your information, to assess the thyroid, you are going to stand behind the patient. For the palpation, you stand behind the patient, okay? The patient is sitting comfortably with the neck in neutral position, and then you stand behind and with the two the pads of your index and middle finger of each side, you palpate the two lobules. The thyroid has a butterfly shape, more or less like this. So you place your two fingers here and here, okay, a little big fingers, but imagine that. And then you ask the client to swallow. Yes, this is the correct technique. So you are learning something that you didn't know, because I know that your program is very deficient in assessment. Okay? Yes, for your information, yes, it is correct. Okay? So it is one of the advantages of practicing question that somebody had, that we can learn something that, little gaps of information that we could have. Ask the client to move the head backward when doing the palpation. So ask the client moving the head backward, okay, backward, while doing the palpation.
Yes.
No. No.
Why not?
Okay, so learn that. The evaluation of the thyroid must be done with the neck in neutral position. So the neck need to be, in neutral position. Neck is going to be, in neutral position. The term is no back, no forward. Is in neutral position. Okay. So don't ask the client to extend the neck, because then it's going to be much more difficult, because the skin and the muscle contract is going to be, the sternocleidomastoids are going to contract when you ask the client to tilt backward the head. And for that reason, the thyroid is going to hide behind those contracted muscles. For that reason, it's not convenient asking the client to do this. This is the rationale. Okay? Auscultate the thyroid gland for presence of bruit. Have you heard something about this?
No.
Okay, but now you need to know that yes. When there is a goiter and the goiter is hyperfunctioning, like for example in Graves' disease, there is a lot of circulation inside the goiter. When there is hyperthyroidism, okay, in the gland, okay, there is a lot of hypervascularization. Vascularizations are blood vessels, and the blood is going to flow very fast and in abundance. And it's the cause of the vibration produced by this increased flow that is transmitted to the skin of the neck. For that reason, yes, part of the assessment of the thyroid is auscultation over the thyroid for the listening of bruit, because this increase circulation. The presence of a bruit on the thyroid translates hyperthyroidism. So probably you are going to find the patient has tachycardia. Yes, the assessment of the thyroid includes inspection, palpation, and auscultation. The only thing that is not needed in the thyroid is the percussion. The nurse is taking care of a patient recently diagnosed of recently infected with chlamydia. Select, which medication the nurse is preparing to administer. Which of these 4 medication is used for chlamydia?
C.
Yes, azithromycin. The macrolides are the drug of choice for the treatment of chlamydia. Chlamydia are intracellular, and the macrolides are very effective for the intracellular chlamydia. Yes, macrolides, specifically azithromycin. Chlamydia is a very common sexually transmitted disease, and usually they simultaneously treat the gonorrhea with cephalosporin, with ceftriaxone, plus azithromycin for the chlamydia. Okay. The nurse is teaching an Rh negative pregnant client before practicing the cum test. What the nurse will tell the client to expect during the testing for cums. After the negative result is obtained, the nurse will administer the Rh immune globulin. This is the other name of Rogan, okay? If you see Rh immune globulin, it is the same as Rogan, yes? Okay. The fetal heart tones will be checked before and after the procedure. The nurse will encourage physical exercise after the test. The client should report if amniotic fluid leaking occurs after the test. What do you think is the correct answer to this question?
A.
Of course, it is a blood
A.
test. It's a blood test. It's a test that is not going to be messing with the fetus or the amniotic fluid or the uterus or anything. So B, C, and D has nothing to do with the cum test. Cum test is a blood test, period. And of course, if it is negative, then because the patients are Rh negative, is going to receive the Rogan. Client in labor is ordered IV oxytocin, which finding requires clarification of this order with the prescriber. Blood sugar high, broken amniotic membranes, epidural anesthesia, blood pressure 130/90. What could be the answer of this question if you had this question in your test? Suppose that.
B.
Okay, why B? Why B? Why B? A ver, why B? What is the reason for which? You know that babies come with a lot of amniotic fluid, okay, around them. And then there is a membrane, the amniotic membrane, that is, it's a purple, that is over there. And then there is a cervix that is dilating, a cervix that is dilating. And is more or less something like this that is dilating. So the membrane is going to be in certain moments visible, okay, through the dilated cervix. No? And there is a moment that the pressure of the contraction is going to break the membrane. And then you are going to have ¿cómo se llama? A fissure, a rupture of the of the membrane, no? And so there is going to be a little opening here in the membrane, and then all the liquid is coming out. Okay, it's coming out, and then the woman will say, my waters are broken. I broke my waters, no? And the liquid need to be examined because should be like the water that is left when you wash oat or you wash rice, but never should be brown or reddish brown, greenish brown, because it's some meconial amniotic fluid. And it's important that at the moment of breaking the membrane, auscultate the fetal heart tones just in case by accident the umbilical cord also, okay, left with the amniotic fluid making a loop inside the vagina. And since the moment that the membranes are broken until the moment that the baby is out, a while can be hours, is going to pass. Is the most important. The membranes should be broken no more than 20 hours, okay, before the birth. When there are more than 18 hours and that the membranes are broken and the baby has not yet been born, we are thinking in the possibility that having this prolonged rupture of the membrane, the need of be careful with the possibility of infection inside the uterus, no? Even prophylactic antibiotics can be initiated. ¿Qué más te puedo decir de las membranes? But the only precaution that could determine a membrane that is already broken, that is no good having, there is no agreement, no? But it's no good having the woman walking too much with the membrane broken, because can have a prolapse of the cord. But in reality, I don't know, and probably you never heard a contraindication of continuing the use of Pitocin because the membranes are broken. What you need to know very well, very, very well, okay, pero very well, is, I demand you to know very well. ¿Dónde estamos aquí? Just a moment, guys. Okay, I demand you to know very, very well, okay? Just a second, let me verify that I'm not messing here, okay. Where am I? Here, yeah? Here, okay. No, this is not. Okay, this is okay. Yeah, sorry for that. Okay, let me save now. Okay, now saved. Okay, what I need you to know is that if the client has one contraction of the uterus every 2 minutes, and or the contraction is lasting 90 seconds or more, the Pitocin need to be stopped. So no Pitocin, no oxytocin, if there are 2 contractions, 1 contraction every 2 minutes, okay? 1 contraction every 2 minutes. It is the same as having 5 contractions in 10 minutes, because 10 divided by 5 is 2, yeah? 5 contractions in a period of 10 minutes, or having 1 contraction every 2 minutes. No, stop the Pitocin. No more contraction, too frequent. Or if the contractions are lasting 90 seconds or more. So in the moment that the contractions are every 2 to 3 minutes and or lasting 90 seconds, you stop the Pitocin. The other reason for no pitocin, no oxytocin, is that the fetal heart rate is presenting late deceleration. Late deceleration is another indication for clarifying any ordering of pitocin. Yes. Pitocin need to be given very carefully, but can be given in patients with previous mean before, yeah, previous C-section, because the presence of this scar in the uterus can increase the risk of rupture, of uterine rupture, but is not absolute contraindication. The epidural anesthesia is not contraindication to use pitocin, oxytocin. The oxytocin has no action in the blood sugar, but the oxytocin is going to produce retention of sodium, retention of water, and vasoconstriction. So there is a tendency to increase the blood pressure when oxytocin is used, and this blood pressure is high for a pregnant woman. If I were in my test, a part of remembering those knowledges that I refresh on you about oxytocin, I would be choosing D, mainly because ruling out pitocin doesn't affect glucose. There is no problem with a broken amniotic membrane. Epidural anesthesia is no contraindication, but obviously could bring problems if the blood pressure is high. This is the way that I would analyze that. I think that we reviewed and went deeper in the understanding of the problem of the oxytocin. What we are adding here is the fact that hypertension could be worsened by the use of oxytocin and needs discussion, clarification with the doctor. Which of the following EKG is an atrial fibrillation? Which one is? It's easy. Which one is? A, B, C, or D?
D.
D as in boy. This one. Very easy to recognize. Irregularly irregular. Okay. Narrow QRS. It is a normal sinus rhythm. What happened here? What is this? What is this little wave? What is this?
It's a P, it's a sinus
A
block.
P. And what is missing here? What is missing after this P?
It's an AV block.
Florence.
The QRS. No? So there is no key. They should have a QRS here after this P. A QRS should be here after the P. Yes, and is absent. Okay. Also is absent here. Yeah. So how you call that? I couldn't hear.
It's a sinus blocker, 2-1.
It's an AB block. Atrial ventricular blockage. AB block. Okay. AB block. Okay. AB block. Okay. So the P is produced but cannot pass to the ventricle. Are we good? So the P is produced, the SA node is producing the P, is generating the electricity in the right atrium, is propagating to the atriums, but at the moment of passing from the atriums to the ventricle is stopped. So there is a blockage between the atriums and the ventricles, and it's called AB block. You don't need to classify the severity. But if you see that a P as in potato, is not producing a QRS, it's because it has been blocked. Is when you are driving to the school and then the police stops you, you understand? Then you don't arrive to class, something like this, no? So it's an AB blocked, okay? AB block, okay. Yeah, and what is this?
It's an ectopic, big ventricular ectopic.
Yes, a PVC, a premature ventricular contraction. So you see that this is the normal, you see the P wave, you see the QRS that is narrow, But then somebody that is bizarre, rare, different, without P wave and very wide, comes very near, premature, before time. Yeah, and it's a premature ventricular contraction. Okay, PVC. Okay, perfect. Okay, there are not too many EKGs in the anchors, but it's not going to harm you answering correctly the EKG question. Are very simple, as you see. The nurse is helping a female client with 6 hours post-labor, postpartum, post-labor or postpartum. Okay, postpartum debería decir. To get out of bed to walk to the bathroom. Okay, the client already delivered the baby. Is 6 hours after delivery, not post-labor, postpartum, yes? And the lady wants to go to the bathroom, so calls the nurse to help her because, you know, at this time, the patient is still a little dizzy. When the clients get up, a discrete amount of dark blood drops on the floor. So when the lady stands up, okay, stands up to walk to the bathroom, okay, an amount of blood falls between the legs and is on the floor. Which of the following is the best nurse statement? Now it's in a statement, so something the nurse says in this situation. Go back to bed because I need to call your doctor immediately. Sit in this wheelchair because I must transfer you to the OR for assessment. Are you dizzy? Let me check your vital signs, blood pressure while standing. It is normal that happens when you get up after resting in bed. It is the lochia accumulated in the bottom of your vagina. What is the most logical answer here? It's not very Diaz in diamond, no?
Yes.
Correct. It is correct. Okay. It is correct. Of course, I'm not sure that always is going to be a question like this, because maybe I was thinking of modifying this question. What you do first? The first that you do is assessment. Okay, you are sure that the uterus is well contracted in the midline, okay, and the patient is not dizzy, is not tachycardic, is not with hypotension, etc. But this option is not included here, okay, because it is included while standing. This is not a adequate, okay, way of assessing a woman in this moment. But you need to know that when the woman delivers the baby, the uterus, okay, is going to produce the lochia rubra. There is going to be blood for 2 to 3 days. But the vagina has this anatomic structure when the woman is resting on bed. Okay, so this is a cul-de-sac where the blood tends to accumulate while the woman is resting on bed. But when the woman stands up, this blood comes out. This blood is liquid, doesn't coagulate. Okay, this blood doesn't coagulate. Okay, and that's why it is a common phenomenon. If it stops, the uterus is well contracted, the woman is stable, it is a normal occurrence, it's a normal situation, in an unexpected, okay, situation. The nurse evaluates a client's EKG and observes a prolongation of the QT interval. Which of the following intervention must the nurse take next?
See?
Yes. The most common cause of QT interval prolongation are electrolyte disbalances, especially hypocalcemia and hypomagnesemia. Remember that the EKG has P, Q, R, S, a horizontal line called ST segment and the T wave. The distance between the Q and the end of the T is called QT interval, and it's very important because certain medications and electrolyte disbalances can produce a separation, a prolongation, okay, of the QT interval, okay, a QT interval. And this prolongation of the QT interval promotes, facilitates the presence of bad, these arrhythmias in the heart that can kill the client. And the most common is the twisting of the points of the QRS, or torsat the points, which is a V-tach, ventricular tachycardia, very severe. Okay, so in general, guys, if you see a client with PVC, dysrhythmias, etc., and they suggest assessment of the electrolytes, 99.99% of the cases, this is a correct answer. Okay, it is a correct answer, definitively, definitively. The presence of the QT interval is not yet producing anything. Maybe never anything is going to happen. So there is no need of calling the rapid response team for that. But you need to call the doctor, and you need to check the electrolytes and report any alteration. And it is not yet producing problem to breathe. And even if the blood pressure is always good to check, the blood pressure has nothing to do with the prolongation of the QT interval. How should it be placed? The car seat of a 2-month-old infant. Center of back, forward facing, back seat behind the driver, rear facing, back seat behind the passenger seat, rear facing, center of the back and rear facing. Which one is the answer?
A.
D as in dog.
Yeah.
D as in diamond, no?
Yes.
Yes.
Okay.
Mhm.
Okay. Okay. Yes. So remember that if it is the back seat, okay, the back seat, the seat need to be in the center of the back seat. Yeah, need to be in the center. So if it's a crash here or a crash here, in either one situation, the child is in the farthest position. But since birth until the baby has 20 pounds, they should be rear facing. So the back is here and the baby is looking in this direction. So esa es la nariz, estos son los ojos. Esto parece más un vampiro, pues. Okay, is rear facing. Okay, here comes the other seat. Okay, and here are you driving. Okay, here is you driving, rear seat, until 20 pounds. After 20 pounds, the baby is too big, and then it's not going to fit because it's going to be fighting with the back of the rear car seat. So now, after 20 pounds is turned, the chair is turned forward facing. So now the baby can be looking forward. And it's going to stay in this chair more or less until 40 pounds. 40 pounds. After 40 pounds is overgrowing the chair. And for that reason, need to be remove the chair, and a booster is going to be placed here. A booster is going to be placed in the seat in the center, and the child will be using their own car seat. The best way of remembering the different moment is the weight of the child, because if we use the age, it's not so good, because the age, 2 years, 1 year, 2 years, babies come in different size. You know, they're bigger and lower. So pounds with the weight is better to decide the size of the child and the position of the chair? So the answer is in the center of the back seat, rear facing. Remember that those chairs must be bought new and guaranteed. If you have an Nclex, a question say what is wrong with the chair, and it's because the parents bought the chair in a garage sale. And each time there is a crash, the chair must be changed, and et cetera, et cetera. And also has expiration. I think that every 3 years they need to be changed. Okay, the nurse received 4 infants, taking care of 4 infants. Infants generally refers to less than 1 year. So the first year of life generally is what refers to infant. After 1 year, they start learning to walk, and they are toddlers. And at 3 years, they already know how to walk. So they are not toddlers anymore. So now they are preschool until they go to the school. Okay. The nurse receive for infants. Which one should the nurse see first? Newborn, 6 hours of birth with yellow discoloration on the eyes. Newborn who hasn't passed meconium in 24 hours. Newborn, 9 hours, who presents bloody vaginal discharge. Newborn, 7 hours with temperature 96.4, which has a priority here.
D as in
D.
boy.
I.
D as in David.
D as in Davy.
Yes. So I have the possibility of eliminating this, okay, because it is normal in girls to have menstruations. And I had 3 problems. This baby has a delay in passing meconium, so need to be investigated. Maybe the anus is not communicating, is imperforated, it's called. Or maybe has Hirschsprung disease, aganglionic megacolon, or maybe has cystic fibrosis. There are many causes for having delay in passing meconium. Need to investigate it. But obviously, it is something that is not emergency. Okay, the fact that the baby has no poo in the first 24 hours is not going to be an emergency. It must be investigated, but it's not an emergency. So now I need to be left with a child with a pathological jaundice because it has just 6 hours of birth and is having a jaundice. And a child with hypothermia because this temperature is low. Yeah. Anything that is below 97.5 is hypothermia in a newborn. So I have who is going to be affected first, the one with hypothermia, the one that is too cold, or the one that has a jaundice? Obviously, the one that is too cold. The jaundice, okay, is going to be something to treat, something to attend, but the jaundice is not going to be an immediate, right now, in this moment, threat for the life of the baby. It's something that needs to be attended, but it's something that is going to be treated in the upcoming hours and days. But the hypothermia must be treated immediately because hypothermia can kill a newborn. Babies cannot shiver to generate heat. And when they have this hypothermia, they don't have mechanism of elevating the temperature. And they develop a thermic shock that can kill them. And the only thing that they can do to elevate the temperature is to burn glucose. And usually they are born with a very low blood sugar. So it's totally risky, the hypothermia. So the 2 priorities of a baby when is born is first breathing, oxygenation. Everybody knows that. The next one is maintaining an adequate temperature. The second stuff that kills newborns, babies, after respiratory problems, after asphyxia, is the hypothermia. And yes, there is priority of the hypothermia over the jaundice. And I hope that everybody understood and got that. There is no doubt about that. This is a question without doubt.
Professor,
Yes, ma'am.
Professor, when is the jaundice is a problem? After 24 hours or before 24?
No, the sooner the worse. In the first 24 hours is the bad one. This baby has a bad jaundice, has a pathological jaundice, a jaundice that is bad, is risky, but the jaundice that is bad, is less imminent, life-threatening condition than the hypothermia. The baby with the hypothermia is going to die much sooner than the baby with the progressive elevation of the bilirubin that needs to go to phototherapy and is going to be treated in the upcoming hours and days. Okay, so at least A, B, and D need to be attended, has problem. But the problem that is more immediate because they are asking which one you see first. So you have a patient with a myocardial infarction. You have a patient that is having a strong chest pain, is sweating, is sweating and has a myocardial infarction. And you have a patient that is choking and has no possibility of breathing, is cyanotic, no? And then they ask you, of these two patients, what you see first, and then you need to decide, okay, to see first the one that have problem of cyanosis and obstruction of the airway, even if the other patient must be seen, but first it is the priority. Why? Because the patient with myocardial infarction, if he's going to die, is going to die in the upcoming hours or days. This patient is going to die in the next 3 to 5 minutes. You need to understand what means first, because those are questions of prioritization. Any person that has problem with the question of prioritization, please, and want to pass the Nclex, of course. This is the other if. If you have problem with prioritization, to decide what to see first, you get confused what to see first, and you want to pass the Nclex, there is a book assigned to you that you should have saved, because you should save all those books that you have in your bookshelf. Bookshelf, something that you have assigned in the school that have many books, yeah? And you can access that, and you have a tutorial in how to access the bookshelf. And there is a book, they say, prioritization and delegation. And the author, the chief author, is La Charity. Okay, La Charity. This book is wonderful, wonderful to teach you ¿cómo se llama? To understand this word, okay, prioritization. Okay. It's a very, it's pure questions, only questions, and it's a very small book, so easy to do quickly. The next most cohort, cohort means placing in the same room. The nurse most cohort, another client with a child with acute leukemia without neutropenia. Which client is the best option for cohorting with this boy with leukemia? Acute glomerulonephritis, recurring gastritis, chronic osteomyelitis, bronchiolitis. What is the best option to put together?
B, recurrent gastritis.
Okay, so we can, in this question, use the best strategy, which is eliminating what is infection. Because even if the patient has non-neutropenia, we don't want infection. So we can eliminate bronchiolitis, which is very, very contagious and should be alone in isolation. And the osteomyelitis, that even if osteomyelitis is standard, is something that is infected. So I have a patient with acute glomerulonephritis that usually is a post-streptococcal strep infection and have a patient with gastritis, yeah, which is a very deep inflammation. So there is possibility that the patient with acute glomerulonephritis still is having in the bodies, either in the skin or in the throat, the streptococcus, so is more infected than the gastritis. So obviously the best combination is gastritis, the one that has no relation with transmissible infections. Are we good? So that's it. I agree with you. The nurse is caring for a client with chronic kidney disease who is going to a scheduled hemodialysis. Which of the following should the nurse be carried out by the nurse before dialysis? Let that apply. So, weigh the client, yes or no?
Yes.
Administer
Yes.
aspirin.
No.
No.
We can heparin.
No. First, because before dialysis, you don't administer medications. The reason is very simple. If you administer medication before the dialysis, the machine will take the medication. So it is a logical reason. And second, it's not convenient. Yes, ma'am.
IV heparin.
Can you repeat?
The heparin is not administered when they're doing hemodialysis?
Yes, I was in the sequence. I know that I'm very slow y fastidioso, ¿verdad? Okay, in the sequence, I was just trying to explain that one reason, because maybe the question says no aspirin, say levothyroxine or levaquin, you know? So one reason for not giving medication before the dialysis is that the dialysis will take the medication from the body, so it's not working. So why you are giving a medication that is going to be taken and it's not going to be working? But also, this patient is going to, during the dialysis, is going to be receiving anticoagulants, okay? The most common is heparin, IV heparin, yeah. So there is no good combination of antiplatelets and heparin because it increases the risk of bleeding. So there are two reasons for not using aspirin, okay, before going to dialysis. The patient can perfectly have a part, a case. It's not this case. So this case is no. It's no. But suppose that you have a patient that have history of transient ischemic attack or stroke, and also have chronic kidney disease and is in dialysis. The patient must take aspirin or clopidogrel. But this aspirin or clopidogrel is going to be left after the dialysis, not before the dialysis. For two reasons. First, it's going to be taken from the dialysis, which is nonsense. Why you give a medication that is going to be taken? You give and is taken, okay? And second, because will increase the risk of bleeding during the dialysis. Immediately the dialysis stops, the action of the heparin also stops, and the patient is not anticoagulated anymore. So now the aspirin or the clopidogrel can be given after dialysis to prevent the stroke. You understand? But the rationales are those. The rationale are both, okay? So that's why it's a no. It's a no. The example that I put here is not related to the question. It's just to make you think in another possibilities. Assess for bruit and thrill in the AV fistula, yes or not?
Yes.
Draw a specimen for blood for creatinine, yes or not?
No.
No, because there is not any logic on that. A patient is going to dialysis. The patient is going to dialysis, what is expected that creatinine will drop. Yeah. So why you want to know the creatinine level before dialysis if you know that the patient is going to dialysis. There is no logic for that. Absolutely no. Evaluate vital signs, yes or not?
Yes.
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 Before
Keep
and
the
after.
client's MPO for dialysis.
No.
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 Patient can eat. Okay, that's it. Very good. Very good. Very good. Which of the following findings in a client returning from hemodialysis to be in the same topic requires priority follow-up? Extreme fatigue, nausea and headache, temperature 101.4, puncture site dressing stained with red blood.
C.
Obviously, C is a concern, okay? Because could be an infection. Although, don't forget that the hemodialysis elevates the client's temperature because the machine must warm the blood before returning. But still, it is a fact, yes. Is there any other complication immediate after ending the
Oh, yes.
hemodialysis that could
Yes.
concern you?
B.
This equilibrium syndrome.
Syndrome. Yes. Yes.
This equilibrium syndrome, in which the patient can present brain edema, could present brain edema as a consequence of the disbalance, the gradient of concentration of the urea in the brain, in the blood. The dialysis lowers the urea in the blood, but not in the brain, and it can produce a disbalance and a gradient of concentration of the urea that is osmotically active, that can draw water from the blood into the interstitial space of the brain, producing brain edema. And so I could be also concerned about this. So I need to decide between B and C. The fatigue is expected, and some blood there is expected. So obviously, with this systematic strategy that I recommend you of simplifying the question and deciding only with two options, okay? If it is not possible to immediately choose the option, I think that is between B and C. Being B, brain edema. Being C, a possibility of infection. What could kill the patient first, the brain edema or the infection?
Brain edema.
B.
The brain edema.
The brain edema.
Yeah.
So I suspect that it is a tricky question of the real life in which they are exploring. If I know that one possible complication of the hemodialysis, especially the first hemodialysis, the earliest hemodialysis, is brain edema. So I have these two, and is something to, because they are asking about the priority follow-up. The priority follow-up. So again, you are in this kind of predicaments at the moment of taking the Nclex. But you know, doing educated guesses, I noticed that when the people can do that, they pass at the end. They pass at the end. You don't need to get 100 to pass the Nclex. Which of the following clients would the nurse see first? Another prioritization question. Graves' disease with temperature, which is high. Type 1 diabetes and blood sugar 134. COPD O2 sat 90%. Post-surgical client hemoglobin 10.5. So again, we can rule out the COPD because it's perfect. And we can rule out the diabetes because it's also okay. Has no ketosis, there is nothing else.
Okay.
So we have an anemia and we have a fever in Graves' disease. What is the priority?
Great disease.
If this is
Grave disease.
A, because we should rule out here what condition?
Thyroid storm.
Exact, the storm, because the fever. Because the fever. And this is something that requires acute attention. What is the medication most important to give in a thyroid storm to save the life of the client?
Ibuprofen.
Propranolol.
Propranolol.
This question is in the English like this. Which medication is the priority I need to be given first in thyroid storm? Propranolol. Because the anti-thyroid medications are very slow. Take days and start working. It's the propranolol, the one that stabilizes the patient. A nurse from the pediatric unit is floating to the medical surgical floor, children to adults. Which of the following client should the charge nurse assign to this nurse? Male, 67, admitted with uncomplicated myocardial infarction. Male, 14, with acute lymphocytic leukemia receiving chemo. Female, 43, admitted 2 weeks ago with respiratory sepsis to be discharged today. Female, 75, with ischemic stroke who was transferred from ICU to med-surg floor. Okay, so let's rule out the one that can be ruled out quickly. Okay. The discharge can be ruled out. Discharge is too complicated. Discharge requires a lot of paperwork and a lot of teaching and a lot of consult with the social worker, explanation to the family. Very complicated. It's the easiest for me of eliminating. No? I need to give the most stable and the easiest client. Okay, and let's see. I have now a patient with an old patient who has an ischemic stroke and is stable because it's transferred from ICU to med-surg. So I start liking this client. I have here a young client, but is not stable, has an acute leukemia, and is in chemotherapy. So it's like too complicated care to be given to the floating nurse. And then I have the myocardial infarction, okay? But was admitted today. So has a myocardial infarction of 24 hours. So definitively no. So don't you think that the most stable is D? What do you think?
Yes.
Everybody agree with me?
Mm-hmm.
So I just wanted to because I didn't know which one was the most stable. But this is, I just was thinking in loud voice to suggest you to do the same in the test. Okay? Take your time, okay? Don't procrastinate, don't exaggerate, don't que no se pasen maraca. But take your time in the test, okay? Take your time in the test. The nurse is observing 2 CNA, changing client position from supine to left lateral. Which of the following requires nursing intervention? What is wrong? So trying to imagine the technique to turn the client from supine to lateral. So A, flex, so is to left lateral. Flex left arm before turning. Flex right leg before turning. Flex left leg before turning. Flex right arm after turning. Trying to visualize a person that is supine. So in the test, is supine. So it's like this, supine. And now is going to be lateral. So it's going to be with one leg, pardon, one arm under the body. You don't want this arm under the body. Need to be flexed. Yeah. To avoid the arm, the left, because this is the left arm, to be under the body, you need to flex the arm before turning the body. Yes, because if you turn the body without flexing the arm, then the arm will be left under the body. So flex the left arm before turning is okay. So this is not. Do you agree?
Yes.
Yes.
Okay. The right arm also need to be flexed because you are going to be like this, but it's going to be flexed after you turn the client. So after you turn the client, or at the same time that you turn the client, then the right arm should be flexed. So this is correct. Let's go to the leg. For having a patient in lateral position and keeping the patient in this position, it is what is called the ¿cómo se llama? The recover position. One leg is going to be straight and one leg is going to be flexed. Okay? Because if you keep the two legs straight, the client will fall in prone position, boca abajo, no? In prone position. So obviously, I need to decide which one is the leg that I'm going to leave flex. The one that is down or the one that is in the top. So usually we place one leg straight and the other leg is going to be flex. Okay. But generally the leg that is going to be flexed is the upper leg. Okay, the upper leg. So the problem is that before turning, the left leg is not flexed. Is the right leg, no? Is the right leg. So this is correct. So what is incorrect is flexing the left leg. I think that is this way. Let's see the technique. Okay. So this is right, this is left. So first you flex the upper arm, sorry. Then you grab, okay, you leave the lower leg straight and you grab the upper leg and you flex the upper leg. That is going to keep the client stable. Okay. And the two arms need to be flexed. Okay. I think that is the same. It's a little complicated, no? A little complicated, but not. You know that it is the recover position, the position that you place patients after in anesthesia, position that you place patients after seizures, etc. Patients that are sedated and you are afraid that could be vomiting, is the recover position. So both upper extremities are flexed and the upper leg is going to be flexed to stabilize the patient in lateral position. An easier one. The nurse observes the provider doing the following maneuver in a client with fever and headache. And then you have a picture. The nurse recognizes that the client presents a positive. What is the positive here?
D.
D as in dog.
Kerning sign.
Kerning sign. Okay.
Kerning.
Remember, there are two signs of meningitis. Okay. One is when the doctor elevate the head, flexing the neck, okay, flexing the neck, okay, flexing the neck. O sea, the hand of the doctor is here, flexing the neck, and then the child will flex the two legs. The two legs will be flexed by the child, okay? And this is the other. The doctor trying to elevate the leg straight, pushing down the knee, but the patient overcome this force and flexes the knees, So these are the two signs. Both are expression of the irritation of the meninges. This one, in the one that the patient flex only one knee when trying to elevate the head, the leg straight, is knee Kernick. Kernick and knee are written with the same K. And these, when you elevate the brain or bend the neck, bend is the Brudzinski. Okay, so you have confusion one or the other. When you see an infant in this position, okay, in this position, okay, in this position, okay, okay, this is the nose, okay. It is opistotonous, okay? Opistotonous, okay. No más fácil aquí. Okay, so don't confuse Kernick and Brudzinski, okay? Because it's the usual question. They put the two signs at the same time, and you need to recognize this. Okay, the nurse observes the sudden beginning of the following rhythm in the client's monitor. So obviously an atrial fibrillation. Which of the following drugs the nurse expects to be administered to return the client to a normal sign of rhythm? Warfarin, metoprolol, amiodarone, digoxin.
Amiodarone. Yeah.
For chemical cardioversion of atrial fibrillation, amiodarone. I agree. If they don't want to produce chemical cardioversion, o sea, return to normal sign of rhythm, they leave the client with warfarin and metoprolol. Yeah. But if they want to do a chemical cardioversion to return the patient back into normal sinus rhythm, and they don't want to use electricity, they use amiodarone. If you have any doubt what I'm saying, please ask. Is a question? No? Okay.
No, professor.
Okay. The nurse observes the following scars. Okay, with the following scars, you're not putting the scars. Okay. A picture is missing here. Well, I should be a picture is not there. I'm so sorry, guys. It has a lot of defects, those questions. Those are questions that I create. Okay. I invent with information that I verbally receive. Okay. Somebody say, I have something like this. And I create a question. Sometimes I forget. I was pretty sure that I had this picture of a shingles. Okay. The nurse observed the following scars in the trunk of a client who recently was diagnosed with herpes zoster shingles. The client is complaining of intense burning pain in the area. Which of the following drugs the nurse expect to be prescribed to manage this pain? Ketorolac, acetaminophen, gabapentin, abimorphine. What do you choose?
Gabapentin.
Gabapentin. Remember that it is a neuropathic pain, and neuropathic pain, like the pain of the shingles, the pain of the trigeminal neuralgia, the pain of the phantom limb pain, ¿qué otro pain? The polyneuropathy, the pain of the polyneuropathy. Those neuropathic pains, the diabetic neuropathy, are treated with anti-epileptic medication like gabapentin, carbamazepine, etc. Okay, because this kind of pains don't respond very well to the analgesics. Expected finding a client with metabolic syndrome. Remember the metabolic syndrome, the apple-shaped obesity, pear-shaped obesity, increased risk for type 1 diabetes, low HDL cholesterol, increased hip girth measurements. What's your response here?
C.
I agree
C.
with you. I agree with you. Is the waist, not the hip girth, that one that is increased. Is type 2, not type 1. And is apple shape, not pear shape. But characteristically, the metabolic syndrome has low good cholesterol. So the HDL cholesterol, the happy cholesterol, is low. Good. Emil Klein, diagnosed with paranoid schizophrenia, is committed to hospitalization by the police. When found hallucinating, armed with a rifle and threatening to kill everybody. Okay, this is going to be one day is going to be me in the school. Okay, since admitted, the client has been physically aggressive with the nurse and other clients. Which rights keeps the client when hospitalized as involuntary commitment? Did I practice this question with you? No, ¿verdad?
Yes.
Yes. Yes.
Yes,
you did.
we already
That's-
practiced this.
Yes.
Yes.
That sound familiar. Okay, maybe I'm repeating some question here. Okay. Which of the following findings require clarification of a prescription of metformin? Blood glucose 80, allergy to sulfa, BUN 35, MRI with contrast order.
D.
B1 35.
The problem here is the renal failure. BUN normal is 10 to 20, and this BUN is elevated, suggesting renal failure. Metformin cannot be used in renal failure. The contrast used in MRI is not iodine, and the iodine is the only contrast that contraindicates the use of metformin. Okay, so it's okay. Sulfa has nothing to do with metformin, and metformin is not hypoglycemic. So metformin can be taken with normal blood sugar because it doesn't lower the blood sugar. The mechanism of action of the metformin is improving the tolerance or the sensitivity of the receptors of insulin. The nurse practices a capillary blood sugar determination in 60-year-old oriented male client and shows the normal results to the client. Later, a client adult son approaches the nurse and asks for the result of the blood sugar. Which is the best answer?
B.
B.
When you see B, is B or D? B as in boy or D as in diamond? Or
Yes,
Boy.
boy.
I think B.
B as in boy.
This
Okay.
kind of rough.
Sounds rough, ¿verdad?
Yeah.
Sounds that is going to produce a reaction, ¿verdad? Oh, qué pesada esta enfermera. ¿Qué se creerá ella? Ese es mi papá. So, is there, okay, it's correct. B as in boy is correct. But is there a better option there?
D as in David.
I think so. Because that's why they gave you so much information in the body of the questions. The viejo is oriented and was informed of the result of the accuracy. Of course, that you cannot give information to the child just because it's the child, because maybe the viejo doesn't authorize the child to have information. So B is correct, but the problem is what you said, sounds conflictive. It's going to generate a reaction, you know, because people don't know this legal stuff. you know. And you can find this type of questions. I saw this type of question very frequently in different versions in Nclex, in which you find a win-win solution, a solution in which you still keep confidentiality, etc., but okay, you avoid confrontation, unnecessary confrontation, because there is no need of confrontation here with this child, this gentleman. So I think that it is one of the examples in which you need to be smart, not with knowledge, but with common sense, to say, ask your father, he knows it, okay? You can ask your father, he knows it. I told him the result, he knows the result, okay? And any problem, please ask me again. So it's better than B, because you are, avoiding giving information somebody could be not authorized, and you save time because you don't need to go to the chart to find out is this authorized or not, or you don't need to go to ask the client, and it's going to be much more okay, friendly, okay. I remember a question that I commented to my ex-students when I talk about consent in perioperative care in nursing concept 2 of ASN, about an Nclex question of a girl, 17, so a minor, but who was living away of home in a college, in a dorm. And the girl got a pelvic inflammatory disease by chlamydia, a sexually transmitted disease, and had to be hospitalized for IV antibiotic therapy. And then the duty nurse received the phone call of this girl's mother from another state, from distance, asking the nurse, why my daughter is hospitalized, what my daughter has. And then gave 4 similar options. Like, for example, telling the lady what the girl had. You cannot do that. You cannot do that even if the girl is a minor, because it's a sexually transmitted disease, and the law says that you need to ask for permission of the minor to report or inform of the sexually transmitted disease to the parents. This is the law, and you abide the law. You don't discuss with the law. Second, you tell the mother, I cannot tell you. I cannot tell you this information because the law prohibits me doing that. Of course, it sounds rough that you tell a mother, I cannot tell you what your daughter has. Okay, I don't imagine I can imagine the reaction of the lady. But what is correct, like here, based in the legal concept that for STDs, you need to ask for permission from the child to give the information, from the minor to give the information. The other was to pass the buck. Pass the buck is to tell, wait until the doctor comes to asking. This is not a good option, generally. And the best option was, I will pass the phone call to your daughter's room so she can explain you directly why is here, okay, receiving treatment, the reason for which is real. So again, it's the same situation, it's the same win-win solution, you understand? And it's going to be much more practical, and you avoid a discussion, you avoid a conflict. So now, Mira, I see in this question, this other question that I'm commenting to you, that is the same situation, is practically the same situation. Okay, I think that I practice those questions with you. Okay. What ethical principle is behind the fact that selling? No, it is nueva porque it's very new. It's a question that was like 2 weeks ago in one English. What ethical principle is behind the fact? At least I don't remember discussing that to you. So if I discuss that, to help me. What ethical principle is behind the fact that selling donated organs for transplant is illegal and unethical? Critical thinking, guys.
C. B.
B as in boy.
Justice.
Beneficent. Remember that I have hearing problems, guys. I apologize. I know that I should have you should have a better, younger professor, but I have hearing problems. And if you see B and D, I cannot differentiate because my presbycusis prevents me from differentiating the sounds of B and D. And I appreciate when you see B as in boy or D as in David, and it facilitates a lot. And avoid me repeating the same once and once again because it's boring. D as in boy or D as in diamond or David?
B as a boy.
B as in boy. Okay, beneficence. Beneficence is to do good, to do something in benefit of the patient. But this is not the situation here. Guys, you have intelligence. So this is who? This is Bezos. You know who is Bezos, no? You know who's Bezos? A very rich man. Yes. This is Bezos, and this is me. Yeah. This is me. And we both need a kidney. So a person donates the kidney. So here there is a kidney. Okay, a kidney. Okay. If paying money were a way of getting this kidney, because Bezos and me are arguing who is going to get the kidney for being transplanting us. But if money, mula, okay, were a way of obtaining this kidney, who is going to obtain the kidney?
The person who has money.
Bezos. So now with muñequito, I don't know how to say muñequito in English, with little drawings, body drawings, I presented a very childish, childish is a very simple mind like mine, okay? A very, simple mind, a very basic mind, a very, plain mind. The situation. Now that I explain, because this is what I do when I have doubts, I take a pencil and start drawing and trying to imagine the situation. Okay. Now that I explained that, is it still beneficence the ethical principle for which they prohibit or they
No.
prohibit?
Yes, Inca.
It's justice, Professor.
Justice.
C as in cat.
Justice. Now, you know me. Many of you know me. And you know how sometimes obsessive compulsive plan I start repeating. Now, my monotopic is Disney. I'm telling my students that the problem that some of them have, that they don't have, critical thinking or imagination, is that they are not going to Disney. So I'm sending my student to Disney to see if they develop the capacity of critical thinking and imagination, okay? And stop being so factual and so, I don't know. So try to do what I'm doing in your test, because I know that you're smart, that you can reach those conclusions. Okay. So trying to imagine the situation when you don't know you don't know what to answer, and then you start guessing, trying to improve your chance of passing the Nclex using your wonderful brain. You understand? Sorry for the monothema and for the usual nagging behavior, but you know, this is my role. Okie dokie. The nurse is evaluating a 5-year-old male child diagnosed with autism. The mother states that the child has presented delayed in obtaining some cognitive benchmarks and that he never answers when she calls him. Which question is important to be asked from the nurse to the mother?
A.
I think it's B as in boy.
Yeah, me too. I was about to say B.
I think it's D. It's not. It's C.
Why C?
Because he may not hearing. That's why he cannot speak.
Yes, yes. Do you imagine that I would be born deaf, sordo, deaf? And of course, because I'm deaf and having delays in my cognitive benchmarks, so, and learning in the school, etc. And I am classified as retarded or autism. Can you imagine the situation or no? Can you go to Disney or not? Can you imagine the mistake and the harm in a child that would be diagnosed as autism because of being deaf? Why it is important? Because the questions say the child never answers when is called. The mother says that the child never answers, never answers when she calls him. Is there? Is there? You know? Is there? This question is very young, very new also. It's a very recent question. Okay? A very recent question. Okay? A very recent question. Because if the child is diagnosed with autism, we know that is having repetitive movement. So it's not going to be beneficial to know something that is part of the disease if the child has been already diagnosed with autism. The overreaction with the routine changes is typical, it's characteristic of the autism. So if A is typical of the autism and B is typical of the autism, A and B are the same. Are the same. So cannot be the answers, because if two stuff are the same in a select of that multiple choice question, cannot be the same. And is your child able to dress and undress? Obviously, is this having delays in the benchmark? Maybe yes. And what you and what you are solving with that? What you are solving with that? So practically is the same also. But what is the issue? Is if the child is deaf. What is? Do you know what is sordomudo? No, that people that are born deaf don't learn how to speak. Have you heard about this, guys? You need to know that sordomudo in Spanish, okay?
Yes, sir.
Okay.
Yes, sir.
Okay. That people
Yeah,
that
Professor, but I have a doubt about that question because the patient is 5 years old. He must be seen by the pediatrician previous year. So the early assessment should determine if
you want to rewrite the question. You want to be cacatua. I call the ladies that the people that writes the question
no,
in English. I call the cacatua. You want to be cacatua.
no, I
Okay,
don't want
so
to.
so don't overthink. Don't add anything to the question. Accept the question the way that it comes. So, well, the child has 5 years, must be going to the pediatrician, and the pediatrician needs to be diagnosed the deafness. No, maybe.
Sometimes poor population doesn't see a pediatrician.
Exactly. Maybe is an underdeserved, okay, child, okay, and is not has the option, or maybe the pediatrician is a retarded like Professor Bajin and didn't think about this and gave the label of autism, because it's like a stamp, no? That you stamp everybody is ta, 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 ta. The poor child is a little retarded autism. Now everybody's autism and everybody's bipolar. It's like those rubber stamps. Have you noticed that? So
Thank you for making me laugh, Professor.
Okay, yes, this is part of you. Remember that I'm professor and comedian. Okay. let me show you something. I have been teaching for a while. Let me see because okay. I've been teaching for a while. And many years ago in a previous school, the student gave me this gift. The Professor Bajin, okay, professor and comedian. This is here, okay. Dr. Bajin, Carlos, professor and comedian, okay. And I believe since my student that time, I've been believing that I'm comedian. Of course, I'm más
You are the
pesado.
best professor.
Más pesado, soy más pesado. Okay, I don't know how to say that in English. I'm more, nothing a comedian, but I like to be comedian. I like to be entertainers. Okay, so now it's just to make you understand that in Nclex, a part of your basic knowledge, which is the basic, you are going to be tested for your critical thinking, your common sense. Is the experience that been acquiring after spying on Nclex for so many years. That is an excellent test that gives you real life situations. Just to see how you to react. Remember of the question, you are going to have 75 questions or more. But suppose that you have 75 questions. Remember, 15 questions are not going to be evaluated. So you are going, if you pass with 75 questions, you are going to be evaluated with 60 questions. Always 15 questions are not evaluated. And you don't know which one are those questions. Come randomly. Maybe the first question you have in your test is not evaluated. Maybe question number 5, 7, and 8 are not evaluated. And then question 23 and 26 are not evaluated. Come randomly, okay? But we never know which of those topics are evaluated or not. But what I'm sure is that they make very, very interesting scenarios that with a little common sense and a little imagination and drawing muñequito, okay, you can reach a educated guess, okay, and of course eliminating options that are incorrect, etc. Sometimes I make question of a medication that the only option you have is to know the medication, period. But notice the number of questions I've been having here in which you need to be using your critical thinking. Okay, let me finish this page because I need to end a little early today, guys. I have something to do. A nurse is providing care to a 15-year-old female client who arrived to the clinic requesting an abortion. 15 years, wants to abort. She can't without consent. The client states that the parents are unaware of the pregnancy and would like to keep the treatment confidential. What is the correct response of the nurse? Is another. Those questions that I have here are very, very recent. Let me see which options I decided to use. We cannot perform this procedure without your parents' consent. Second, I will inform the healthcare provider of your wishes. Pass the buck. Don't choose that. 3, are you aware of all the risk involved with terminating your pregnancy? D, how did you arrive to the decision to terminate your pregnancy? So you have these 4 options and you need to choose the best.
C as in cat.
Obviously, you are like me, you are anti-abortion because you want to discourage the abortion. In my case,
what about D and David?
In my case, because my belief, okay, that's why I would never being able to work in this area. I would be discouraging the abortion. That's why I cannot be honest or be neutral or be you know, just adequate in an area like this. But the problem of C is that you are in some way implying that there are risks that she should be aware, and in reality it is correct to inform of any risk. But when we say, are you aware of all the risk involved with termination your pregnancy, it is going to have like a induction of inducing decisions. We are going to induction of the final decision. So it's correct, but it's also incorrect. It's correct because it's giving information that should be given by the provider and not by the nurse.
And she will say yes or not. So you don't want a yes or no.
Another against that is a close-ended question. So you see that there's several details of this option that make it not the best. First, you are inducing a rejection of the abortion. Second, if you give this information, you are not the person to give this information. This information needs to be given by the provider, the one that is going to do the abortion. In third, it is a close-ended, question. It's a yes or not question. So I think that we could look for a better option that is not the best. Don't pass the buck. In this kind of question in Nclex, don't pass the buck. Of course, sometimes you need to pass the buck. You have the patient with appendicitis and most need has surgery. You need to pass the buck. What can you do? But in this case, don't pass the box. Trying to find a little more information, etc. It is true. A is true. A is true, but again, could bring conflict. And what could do a 55 years old girl that wants to have abortion, and you say we cannot do that? What she could do? She could go to another place. And this another place could be less safe than ours. So I have also concerns with option A. So what is the neutral question, the question, the classical therapeutic communication question that allows you to make assessment and find more information and consider just gathering information that would allow you to make a better decision, that if you need to explain her that it's illegal to do that, but you know that it's not good to go to the illegal site to do the abortion, or that if you know if she needs to talk to the physician, etc. So obviously, after analyzing the options in such a delicate question, okay, if I were in the test, I think that the option they have the least inconvenience, the lowest possibility of having problems is D as in diamond. Okay, because it's an open-ended question that allows the patient to express, okay, to speak up, which is the most that you can do there, because you cannot do the abortion, you cannot, give information beyond the basic, etc., etc. And of course, it is a very delicate case. So.
Professor, I have a question. Is it right to say we cannot choose A because she's an emancipated minor?
She's not emancipated. Pregnancy doesn't emancipate.
Because she's pregnant? No?
No.
Oh, okay.
So you need to know that marriage emancipate. Pregnancy gives rights. She has the right for prenatal care without knowledge of the parents. She has a right to take decisions of the care of the baby if the baby is born. She has the right to give the baby in adoption. She has the right, if the doctor authorizes, she finds that she's mentally competent, to give consent for her child. But she's not emancipated. The legal term of emancipation basically are three. One, marriage. Second, the court declares the minor emancipated. And third, has 17 and go to the army. Those are the three accepted in all the states of the union that emancipates the child. But just becoming pregnant, if you have a mental retarded a woman, down that cannot become pregnant, but a mental retarded girl and become pregnant, you cannot emancipate this girl. If you have a 11 years old girl that has been raped and is pregnant, you cannot emancipate an 11 years old girl just because it's pregnant. So pregnancy alone does not emancipate. Does not emancipate.
Professor, thank you for the clarification, because earlier I was reading that emancipated minor can establish independence from their parents through marriage, pregnancy, service on force, and court order. But
no, pregnancy.
Like it's only 3.
Pregnancy, okay. No. I have literature. I can. If you send me later an email, I can send you the literature because I have the literature about that. Okay, the literature from the lawyers explaining why pregnancy doesn't emancipate automatically, and makes sense. Makes sense that just because a girl is pregnant doesn't emancipate her. It's still somebody need to take care for her decisions. And in the case of abortion, in all the states of the union, a minor cannot, okay, but there is no emancipated, of course, cannot do abortion without the consent of the parents. Okay, they can have prenatal care, they can ask for whatever, but no abortion. No abortion. Okay. So remember that you are not a lawyer. You are not going to have a question that is so complicated. A question that maybe the hospital is going to consult the court or consult the lawyers that give assessoration of the hospital. So this is not the level of question you're going to have. Here is very simple. It is a very complicated situation. It's a teenager pregnancy with a very conflicted situation. You want to keep the girl under the system, the healthcare system, without going to the illegal sources of abortion. And it's a delicate question. And obviously, D has not any objection. There is nothing wrong, nothing to any but in option D, because it's just allowing the girl to explain, okay, how she decided to terminate the pregnancy. It's just allowing her to speak. In which of the following diseases the nurse knows that thrombocytosis, ese también lo hice con ustedes, creo. Thrombocytosis is present. Thrombocytosis is elevation of platelets, no? So what is the disease?
Polycythemia vera.
Polycythemia vera. Polycythemia vera. Which of these positions is used to evaluate the external jugular vein pressure? A, B, C, or D?
B.
B.
B as in boy, 45 degrees elevation. The nurse is caring for a 2-year-old child with a hip fracture interaction. Which of the following distractive activities is appropriate? Large pieces puzzle, blocks, 2 years. Nintendo, large print books. Obviously, you are not going to give large print books to a child of 2 years. Nintendo is not adequate. So, what do you think?
B. Blocks.
Blocks.
Obviously, blocks is much better than large pieces puzzle, because a part of that probably the child will be swallowing, okay, one of the large pieces of puzzle. Yes, blocks I think is the best. Okay. Let's do the last. The nurse is preparing an intramuscular dose of carboprost. Did I practice this question with you?
No.
No, ¿verdad? Carboprost for post-trauma. I practice so many questions with so many people, guys, that I have a storm in my mind, in my brain. Carboprost for a postpartum client presenting abnormal vaginal bleeding. So it's a question of pharmacology. It's a question to learn about carboprost, which finding requires clarification of the order. Client saturates a perineal pads in 20 minutes, history of asthma, allergy to sulfonamides, history of peptic ulcer disease. Which is your answer? Just guessing if you don't know.
D.
Okay, carboprost. Carboprost is one medication, is a uterus stimulant, the same as the oxytocin, that is frequently used because it's given parenterally, is given parenterally, could be given intramuscular or intravenous, in patients that requires contraction of the uterus, of the smooth muscle of the uterus, because the uterus is boggy, and for that reason is bleeding. So a part of oxytocin that can be used after the baby comes out and the woman is bleeding because the uterus is not contracted, carboprost can also be used. Carboprost belongs to the family of the prostaglandins, yes. And prostaglandins, okay, prostaglandins has many functions. Prostaglandins can participate in the process of inflammation, producing swelling, pain, etc. Prostaglandins stimulates the smooth muscle. A smooth muscle is the muscle that you don't have control on it. It's the muscle that can contract and relax without asking permission to your brain. Smooth muscle. You have a smooth muscle in arteries. So you have arteries. Arteries in your body have circular smooth muscle. And the prostaglandin stimulate the smooth muscle. You have a smooth muscle in your bronchi. Your bronchi have circular smooth muscle that when it's stimulated, of course, produces bronchoconstriction. And the stimulation of the smooth muscle of the artery produces vasoconstriction. You have a smooth muscle in the intestine. Yes, in the intestine. The intestine has a smooth muscle. Each time you go to the bathroom, each time you eat and you have peristalsis, this smooth muscle is contracted. So you have a smooth muscle in your intestine. And you have a smooth muscle in your ¿cómo se llama? In your uterus. So this kind of prostaglandin, carboprost, stimulate the smooth muscle of the uterus, smooth muscle of the arteries, smooth muscle of the bronchi, and a smooth muscle of the intestine. Are we good? Are we following? Carboprost is frequently used in OB when the woman requires uterine stimulant, okay, after birth to make a strong contraction and stop the bleeding. So they are asking here about the side effects. We already know for what is the carboprost, but here they are asking about side effect. If they produce vasoconstriction, elevates blood pressure, yes or not?
Yes.
So could be contraindicated in hypertension, no? If produce bronchoconstriction, you don't want that in asthma and COPD. So could be contraindicated in asthma and COPD.
Yes.
And if it produces stimulation of the smooth muscle of the intestine and also the stomach, can produce nausea, vomitus, abdominal cramps, and diarrhea. Yeah. So now, understanding the anatomy and physiology of the smooth muscle and understanding that carboprost stimulate all the smooth muscles of the body, we could answer better questions about the use of the carboprost. Remember that the other prostaglandin that is also used in OB is the mesoprost, prostaglandin, prostol, okay, the misoprostol, that is frequently used to induce abortion because, is when given early, contract the uterus and the uterus spit out the ¿cómo se llama? The embryo. Yeah. So the answer of this question is
B as in boy.
asthma. Okay. Asthma. Okay. The nurse working in the ER received a client with a chest wound. I have the sensation that I practiced this question with you. With whom I practiced this question? I don't know. The nurse working in the ER received a client with a chest wound produced by a sharp object. Okay. The nurse hears a sucking sound each time the client breathes in. Which of the following interventions is appropriate? Remove the penetrating object from the wound. Place the client in the Trendelenburg position. Initiate IV infusion of normal saline with catheter in both arms. Cover the sucking wound with non-porous gauze and carefully tape the four sides.
C as in cat.
D as in David.
Okay. So if you cover the sucking wound and tape the four sides, you are creating the possibility of a tension pneumothorax.
Correct.
Need to be taped only three sides. Only three sides, because if you tape only three sides, the air can leave through the 3 side, but if you tape the 4 side, you are placing a seal that could allow the air builds up inside the pleural cavity and reach a high pressure that could shift the mediastinum to the other side, which is the tension pneumothorax. That's why the 4 is, but I don't like of this option. Trendelenburg is making the patient breathe worse. If you place a patient Trendelenburg, the diaphragm move up, and then the lungs are going to have less space to expand, and the respiration is impaired. That's why Trendelenburg is a very rarely position used nowadays. They prefer the modified Trendelenburg, which the patient is just flat with elevation only the legs. Okay, and so it can be ruled out. Do you never remove the penetrating object because it can precipitate a massive hemorrhage, because maybe the object is compressing, is making compression of the arteries, etc. And I don't like the first. So I think that the best option here is C. If I were having this question in my Nclex, I think that C has no objection, has no critique, because obviously this patient requires IV fluids and should be administered through 2 catheters, always to have an alternative catheter. And the last, yes.
You're clear. You have a question like that on Monday.
Oh, yes. I know that I practiced that with you. Yes, because
it was not that one. It was a similar one, not the same one.
A similar one. Because as I said, people come with the same question, but are with little differences. They have 99 versions of each question. Which of the following mechanism of action is the indication of using dioxin? Inotropic negative, beneficial in ischemic heart disease, calcium channel blocker, beneficial in hypertrophic cardiomyopathy, chronotropic negative, beneficial in atrial fibrillation, inotropic positive, beneficial in AV block. What you answer? Okay.
D as in dog?
D.
D as in dog. No. Let me explain you something. There are 2 properties in some medication that are the chrono inotropic. The last part is tropism. Yeah, each one can be positive or negative. Positive or negative. Yes. The medications that are chronotropic positive speed up the heart, increase heart rate. Yes. For example, atropine. For example, epinephrine. Those are chronotropic positive because speed up, increase heart rate. Medications that are chronotropic negative slow down the heart. Yes, like for example, beta blockers. For example, diltiazem, or for example, dioxin. Remember that when we give dioxin, we need to check apical pulse, and if it is too low, I mean, is less than 60, we can't give the dioxin because it's chronotropic negative. Do you remember? Inotropic means the capacity of modifying the strength, la fuerza, strength of the contraction of the heart. If it is an inotropic positive increases the strength of the contraction. Dioxin is an inotropic positive. Dioxin increases the strength of the contraction. So dioxin is a chronotropic negative, it slows down the heart in its heart rate, but is inotropic positive, increases the strength of each one of those contractions. Less contractions per minute, but stronger. Yes? Inotropic negative are medication that, tells the heart, don't contract so strong. because you are consuming too much oxygen. Beta blockers and calcium channel blockers are inotropic negative and are used in heart, angina, to make the heart rest and consume less oxygen. So inotropic negative is this one, is to put the heart at rest. Yeah. And it's good in ischemic heart disease, but the dioxin isn't an inotropic negative. Dioxin is an inotropic positive, and it is used for heart failure. Calcium channel blocker, okay, is an chronotropic and inotropic negative, and is used in this very rare condition called hypertrophic cardiopathy, but is not dioxin, so it is an easy one. Chronotropic negative is slow down the heart rate, and in atrial fibrillation, we just use medication to slow down the heart rate. Dioxin is just a chronotropic negative, and is just beneficial in atrial fibrillation. One of the medications to slow down the heart rate in atrial fibrillation, especially when there is heart failure, is dioxin. Dioxin is inotropic positive. Yes, it's true. It's inotropic positive, but cannot be used in AV block. Why? Because it is a trap. AV block produces bradycardia, slow heart rate. Yes, and as a consequence, you cannot use a chronotropic negative because it's going to slow the heart rate even more. So yes, it's a question that is a little difficult, but it's a question about dioxin, a very basic medication that we need to know very well. Okay, so the answer is dioxin has chronotropic negative action and is beneficial in atrial fibrillation. Okay, guys, I'm sorry, but I need to leave you because I have an important stuff that have been assigned to do in this month. Okay, any question?
No, Professor, thank you so much.
Okie dokie. So see you on
Monday.
Monday. Okay. Good
Thank you,
night. Happy
Professor.
weekend, and study a lot. Study a lot because you are doing very well. You are in the good track. Okay. Okay. Safe.
Thank you, Professor. Good night.
All right. Let me get the attendance.